Good morning, everyone. Great to see everyone here this morning. My name is Kathryn Chapman from Innovate Cambridge, and I'm going to be moderating this panel this morning. So we have, basically, when people talk about Cambridge, we often talk about Cambridge as a university city, and it is brilliant. We have obviously got globally leading research, life sciences, deep tech, AI, but actually it's so much more than that. So Cambridge over the last 50 years with the Cambridge phenomenon, and is that next door? Is that in is that in here? It's next door. Okay. So as part of the Cambridge phenomenon and beyond, we now have a track record of starting and scaling businesses as well, coming out of the university, but also much broader than that. So what we're going to talk about today is to think about now, how do we scale? So thinking about the region, thinking about Oxcam, thinking about the partnership with Manchester, how do we scale the success and track record we've had? So we're going to look at what does the next generation of innovation look like? How will we create the conditions for companies to scale? But also, what will it take to turn world-class innovation into good growth that benefits community in our region? And so, first of all, I'd like to ask the panel to introduce themselves. And actually, some of the panel have come up specially for this one event today. So up from Cambridge to Leeds and then dashing back down. And in fact, I've heard the transport was really easy and really good. So that's useful to know. So George, would you mind just very briefly introducing yourself?
Yes. Hi, everyone. I'm George Malliaras. I'm a professor in the Department of Engineering at the University of Cambridge and also lead the newly formed Institute for Biomedical Innovation.
Thanks, George. Kathryn? Can you hear us okay, by the way? Yeah, okay.
I'm Katherine Rodgers. I'm Director of Property Development at the University of Cambridge, and I'm responsible for the development activity across our operational estate, so teaching and research, and our commercial estate.
I'm Roland. I'm Chair of the Inclusive Innovation and Growth Review, which is hosted by the University of Cambridge.
Hi, everyone. My name's Julia Diez. I'm Head of UK Productive Assets at Railpen. Railpen is a £34 billion pension fund managing money on behalf of the UK Railways. We are one of the largest property investors in Cambridge, and we also invest directly in UK venture and scale-up capital.
Brilliant, thank you. And I should say we're going to try and get this panel finished by 2:45, so we can all jump over to the supercluster or wherever else you're going. You may, for instance, be going to meet the Chancellor if you're some people in the room. Anyway, so I'm going to start with George and have a think about the university's strengths, George. And so can you give us a little bit of insight into what emerging technologies, but also combinations of technologies are likely to fuel the future of innovation and the ones that might be most likely to scale?
Great. Thank you very much for the question. We live in an era of unprecedented challenges, but also opportunities. Things such as global climate change, aging population put tremendous strain on resources. But through new technologies such as AI, quantum materials, new biotech and medtech technologies, and so on, there are tremendous opportunities. So the university is responding to those by reimagining the way it is delivering impact and growth. Traditionally, we talk about technologies as they move from idea to becoming a product in terms of TRL, technology readiness level. And usually universities are positioned at early TRLs where you can come up with an idea and then create the very first prototype. The mechanism for growth then is to start a spin out to mature and de-risk the technology until it reaches the market or until it exits to a larger strategic. The University of Cambridge is reimagining the way it supports this continuum by launching institutes that are placed at higher TRLs where they can handhold ideas and help them cross the valley of death from the first demonstration of usefulness all the way till they become a product. Again, this is a massive departure from the way traditional universities operate. This manifests itself into institutes, for example, the Milner Institute for harnessing biomedical technologies and life science ideas into new pharmaceuticals, the Whittle Lab for low carbon energy technologies and propulsion, and more recently, the Institute of Biomedical Innovation, from taking medtech ideas all the way to clinical trials.
Great. So can you tell us a little bit, if we get this right and these institutes are all successful, what difference is it going to make to people's lives?
So for the Institute of Biomedical Innovation, as an example, we're developing a variety of technologies that are either implantable, devices that go inside the body, or wearable that sit on the body, or in vitro where they integrate with tissue. And each one of these will bring about a revolution in the way we care for people. For example, implantables can today help people with movement disorders, such as Parkinson's, tremor, and so on, that cannot be treated effectively with medication. And then they're pushing into neuropsychiatric disorders, extreme forms of obsessive-compulsive disorder, pharmacoresistant forms of depression can be treated with these technologies. And then further down the line, people with paralysis will be able to have assisted movement and regain autonomic function and all that. For wearables, we see technologies that baseline human health and can tell you very early on if a parameter, a disease marker, is becoming a little bit off kilter, giving you very early warning when treatment can be very successful. And for in vitro systems, especially the ones that integrate human tissues, these can revolutionize the way we develop new pharmaceuticals by testing them not on mice and rats, but on human-derived tissues, making the process much more efficient and less costly.
Yeah, thanks, George. And I guess to Kathryn then, so, building on that, so we've got all of these new technologies, we've got interdisciplinary interactions, the university estate and buildings and districts are a really critical part to that. So can you tell us a little bit about how the Cambridge West and the biomedical campus are contributing to this?
Yeah, thanks, Kathryn. So we're on a mission within our estates division at the university to really maximise the positive impact that our physical assets and places can have in support of the academic mission. And our activities are sort of twofold. Firstly, and really importantly, we're reinvesting in our existing estates such that we can ensure that we're providing the world-class spaces for colleagues such as George to occupy. And that's a significant programme of reinvestment across the city. Secondly, we're advancing a number of major development projects which are really trying to support the ecosystem as a whole. We're delivering housing, but importantly, we're delivering a major innovation district at West Cambridge, where we will co-locate up to 4 million square feet of new occupiers immediately alongside world-leading academic researchers. And the huge opportunity we feel in that regard is the power of proximity and co-location. We know that proximity drives or accelerates innovation, and we have a unique opportunity to create spaces alongside those that George and colleagues occupy to really maximise that impact. So that's what we're sort of very much focused on. In addition to West Cambridge, we're active at the biomedical campus, and also we are promoting a large-scale national innovation hub in the city centre, which will seek to really provide a convening space for the benefit of the region as a whole.
Yeah, and just building on that, so thinking about George's point of having a proof of concept and manufacturing institute, and then thinking about how companies scale, and we'll ask about funding in a minute, Julia. So can you tell us a little bit about the pathway to scale for companies in the region and what that means from a real estate perspective?
Yeah, I can certainly talk to that in terms of how we're trying to support that from the university's perspective. So we have an organisation within the university called Cambridge Enterprise, which is specifically focused on supporting new spin-outs from the university. And what we're trying to do with our physical assets is create a range of spaces that can host new organisations that might need one desk through to major research HQs requiring tens of thousands of square feet. So I think we really see our role amongst the sort of myriad of others who are active in the ecosystem at that intersection of academic research translating into the commercial world, and also trying to focus some of our early activity on creating that infrastructure, be it incubator space, innovation hub space, grow on space, that can really start accelerating that pathway.
And thinking about the region, so how do you see that playing out with Peterborough and Huntingdon and other areas?
Yeah, so I think another sort of important point in terms of the way that we're seeking to approach this. This isn't a sort of real estate driven activity. We're simply here to provide the physical places for exceptional things to happen. It's also not about a sort of competing approach to real estate. We're trying to adopt a sort of whole whole missions of thinking. And for us, this is about the global competitiveness of Cambridge and the entire region. So that's how we're trying to work in collaboration with colleagues, including at RailPen and Prologis and elsewhere, to really ensure that we're working together to attract people from around the world, as opposed to smaller scale thinking in the city itself.
Great, thanks, Kathryn. And Julia, can you give us a bit of a perspective on the funding landscape? I mean, things are really changing at the minute, aren't they, in terms of pension reform? So can you give us a bit of a perspective of, we know we've got the infrastructure, we've got the innovation and real estate. So what about funding?
Yeah, so maybe just some context as to kind of what we've been doing and how we've been doing it, first of all. Back in 2019, we became the biggest investor in a company called IP Group, which is, together with Parkwalk, one of the biggest VC investors in Cambridge. And then after that, we also decided to invest directly in scale-up opportunities. So one of those companies is CMR Surgical, which is based in Cambridge. One thing that we did notice as part of our journey was that, we were one of the very few pension funds that was actually doing this and investing in the UK directly. It was a little bit lonely. And that the real challenge that we were seeing was kind of that scaling point where there's simply just not enough capital, and certainly not enough UK capital going into these companies in order to get some good valuations for the companies, one, but also encourage them to stay within the ecosystem as well. Now, with the Mansion House Accord, which was signed in 2025. What that meant was that certain DC funds pledged to commit 10% of their assets to investing in private markets, of which 5% was in the UK. And that is spread over property, infrastructure, private equity, and venture capital. So that's a good start. Now, progress has been slow, I would say, although there have been some quite interesting innovations, like Standard Life and Schroders have set up a vehicle together called, I think it's called Future Growth Capital, which is meant to kind of try and solve some of the challenges that the DC schemes do have in terms of allocating to these asset classes. And, one of the other fundamental challenges is capability as well. Let's not forget that in order to be able to allocate to these asset classes, you need to develop internal capabilities to be able to analyze opportunities and actually kind of, make those allocations. So, the taps are starting to turn on. But at the same time, I think there's been a meaningful, let's say, re-up in terms of allocation to the BBB and the National Wealth Fund as well. And one thing that we have noticed is that the BBB is really starting to allocate decisively and take direct stakes in companies as well. So they are, I'd say I've been quite impressed in terms of what they've been able to do in a relatively short time so far. The one thing that, we have been working on, alongside, the BBB and the OFI and also, other pension schemes in the ecosystem is thinking about how do we crowd in capital into, some sort of scale-up fund. And we've been quite public in terms of, calling for, a UK scale-up fund that can support our UK companies as well, in terms of that, important scaling part of the journey where they do need substantial amounts of capital and they need the certainty that they can get that capital quickly.
And specifically for the region, Julia, these changes, what difference do you think they'll make for Cambridgeshire and Peterborough?
I mean, over the past 10 to 15 years, a really vibrant venture ecosystem has developed out of Cambridge. And, we're at this point now, it's an inflection point where we're starting to see a lot of these companies come out that have, successfully kind of gotten past that VC stage, but really, are in that kind of growth and scale up stage. So, the fact that, let's hope that the capital is starting to flow. It looks like it is, and it will. That is going to meaningfully translate into more jobs. And, if it's UK capital that is flowing, and hopefully retain these companies in the UK.
So I might ask all the panel this one before we move on to Roland. So at the minute then, Julia, do you think that the limiting factor is capital, talent or infrastructure?
I think it's all three. I think it's all three. I'm particularly focused on the capital side, and I think that they feed into each other as well. So if you can get the talent, you can get the capital. If you've got the capital, you can get the talent. If you get great exit valuations and the founders stay here and reinvest, then again you're supporting that vibrant ecosystem, which is kind of what has happened in Silicon Valley, right? You get a lot of these very successful founders or people that have made a lot of money reinvesting into that ecosystem and building kind of equally great companies.
Does anyone else want to comment on that? No? All three. Okay. So Roland, I mean, I guess if Cambridge is one of the UK's greatest economic assets, you have been thrown in at the deep end to do a review on inclusive growth, I think, at the university. So can you tell us a little bit maybe about some of the early findings you've got from that review? And yeah.
Yes, thanks, Kathryn. So if I start maybe with people, so I've just finished 10 years as the chief executive of Cambridge University Hospitals, and about half of that job is running the hospital for 7 million people as a specialist centre, and about half of the job, Sean, is working with you in AstraZeneca. Ed, I think you were here a moment ago, in working with you on the Cambridge Biomedical Campus, and obviously with George, Julia and Kathryn. And innovation and growth is real. So if I was to take you to one side of the Cambridge Biomedical Campus, I could introduce you to an 85-year-old lady living alone in public housing with both of her feet missing because of diabetes, unable to breathe, unable to get her walker out. And we could care for her so much better with the innovations and technologies we've got available now. We've just failed to get them to her. So innovation doesn't mean a lot to her. If I was to introduce you to Lisa, Lisa was a 55-year-old woman with very advanced cancer that wasn't amenable to chemotherapy or stem cell therapy, and she was going to die. She was going to miss her daughter's wedding. And she was one of the first patients at Addenbrooke's at CUH to receive CAR T cell therapy. She saw her daughter get married, and she's seen the grandchildren. So for her, innovation is a terrific thing. And in my 10 years at the hospital, Kathryn, that's what innovation means for the people that we're here to serve. Innovation and growth can also be frightful or brilliant from a jobs point of view. So last summer, I had to stand in front of 300 members of staff at CUH and say, out of our 14,000, you're at risk of redundancy because technology around outpatient booking, medical secretaries, means that we don't need you. For those people, those 300, innovation and growth is absolutely horrendous. They do not support the current government or the government before it. At the same time, I mean, Sean, your leadership of AstraZeneca in terms of apprenticeships, new opportunities is incredibly powerful. And the 400 nurse apprentices that we've appointed at the hospital give a sense of what we can do for our population. Now, Kathryn, in the 3-4 months that you and I have worked together on the much broader ecosystem, I think you and I and others have really aligned on saying we've got loads of strategies, we've got loads of governance, but we've got to start doing stuff together with enormous purpose and the right resourcing. And Kathryn, you and I and others have articulated really concrete deliverables around things that matter for people, primarily jobs. Number two, what are we going to do about place? And Kathryn, your leadership has been absolutely central to that, but getting the transport strategy sorted, the quick wins for the DevCo, the Development Corporation will be key. And then lastly, George, your leadership in terms of what I would almost call missions or goals for the cluster. You've talked about a number of them in life sciences. What are we doing in aerothermal? What are we doing in artificial intelligence? And I think, Julia, those are what we almost think of as the missions or the spines around which we will build the industries of the future. And Kathryn, just as I finish, I think we've got quite a keen analysis of where we're doing well in these sectors and where the emperor has no clothes. And, I think in life sciences, we're quite advanced, but there are some areas where we need, like, some clothes. We've had 2 workshops, haven't we, in the last 2 weeks around artificial intelligence. For us, it's a cart that's in the ditch a bit. Can we get that up and get it moving again? And sustainability, quantum, and aerothermal are areas that we're paying enormous attention to. And then, Kathryn, as you and I know, deliverables need governance, they need resourcing, and they need a collective ownership and oversight. So that's where I am after 3 months. Thank you.
Thanks, Roland. And also, you've been, as well as doing the review, you've also been travelling a lot, haven't you, and getting an international and national perspective. So Manchester, China, Boston, Paris. So can you tell us a little bit about what you've picked up on those trips and how you might bring some of that learning back, or how we might learn from that in the region?
I'm not to overshare, but I mean, it makes you pretty paranoid. And let's just be really honest in the analysis. We can talk a good game, we should be optimistic, we should build on momentum, but we should also know that we've got an incredibly far way to go. And I'm sure we were in AstraZeneca in the university cluster in Beijing. We talk about China speed. It's 150 days to set up a clinical trial here. It's 2 weeks in Beijing. So I suppose one learning is be prudently paranoid, cautiously optimistic. And then I think the sort of second major finding is every geography in the UK, but I would say the same in the UAE, United Arab Emirates, Paris, Boston, have particular skills and areas of expertise. And if we can get the collaborations going, Kathryn, you've been leading the partnership with Manchester and the supercluster, that's where the really big opportunity will sit. And to look at, in life sciences, pharmacogenetics, how populations respond to drugs, that is something where the UK could be truly distinctive. Similarly, Kathryn, your leadership in graphene through to material sciences, Manchester to Cambridge, will be another area we'd want to focus on.
Brilliant. Thanks, Roland. So are there any, we've got sort of 10 minutes for questions from the audience before we sort of have a visionary statement from the panel. Are there any questions from the audience? Any?
Hi there, thanks. Matt King and I, Senior Projects, I've actually done a lot of work with the Greater Cambridge Shared Planning over the last few years, trying to help them move the local plan forward, which we're battling our way on that. I mean, I guess the question is, so much happening in Greater Cambridge and Peterborough. It's almost like, how do you ensure the storytelling of everything kind of gets out there to people like me, like consultants, to residents, to the world at large? Because it's very fast moving, it's very dynamic. There's some areas that are strong, some areas that are less strong. And how can we kind of all be a part of and stay on the journey of understanding that, do you think? Sorry if that's a tricky one.
So again, not to overshare, we're opening the Cambridge South Station in, I think it's the 28th of June. And it's a huge triumph. It's fantastic. And that was brokered in, Sean, by AstraZeneca. Let's be clear, onto the biomedical campus. And the initial communications and engagement plan around the Cambridge South Station was, we're opening an amazing station. And I don't want to overcharacterise that as points and trains and platforms, But what that really is about job opportunity. It's the beginning of a livable city or the next phase of a livable city. And it's about making breast cancer a long-term condition for 95% of patients with that. So to your point, I think we have to seize every single moment and we have to be authentic in saying, what is this really about and what is it going to deliver for industry investors, our population? And we've got to be consistent across that as we go forward. And we've got to be co-own those things and then be smart in terms of how we present it. The people of Wisbech will not listen to me, they will listen to people from Wisbech, and we need to make sure that they're engaged in the presentation of those developments.
Yeah, I mean, there are two prizes here, aren't there? One is to get more investment into the region because we're describing the story well in terms of the innovation and the opportunity. And I think there's probably two places. So from an Innovate Cambridge perspective, we have a video and a story and that you can use those assets. But I think also thinking about how that plays into some of the Oxcam narrative from an international perspective. And then the second prize is actually working with communities to understand the story so that we can get support for growth. And I mean, we've been having some really good conversations actually here at Reef with Mayor Bristow in how to do that. So I think there's lots of things at the minute of, how can we get the resource to be able to tell those stories? But it's in all our interests to have a clear story and get that message out internationally. So yeah, absolutely. Any other questions for the panel? Ed.
Thanks very much. Ed Watson from Cambridge Biomedical Campus. Just building on Roland's point about the new station, transformational, I think, for the campus and for Cambridge. We hear about, quite rightly, the connectivity east-west through the Oxcam corridor on the supercluster. How important is the connectivity that Cambridge South will bring for Cambridge and the Biomedical Campus to London and the Knowledge Quarter in terms of thinking about innovation and growth?
Shall I? I'm going on to that. So the UK is small, and Cambridge is tiny, but Cambridge does have. But Cambridge with London, with Manchester, with Oxford, with Sheffield is going to have to bring the same energy we've seen in the last 2 years to the sticky edges and where can we make a difference. And it was interesting in the 2 workshops we've held on artificial intelligence. We've been really honest in the analysis of where we are strong and where we're weak versus or alongside big technology companies and computing power. So I think working out those areas where we can say apply artificial intelligence to what I would call verticals or segments like aerothermal, like life sciences, will mean, Ed, that we're going to have to partner much more effectively with those other clusters. And this is in a world where historically, particularly from a university perspective, we have competed. And we're going to have to find a way to, as a country, respond in a different form.
I mean, I think, Ed, Cambridge South, without a shadow of a doubt, will be transformational, particularly for that link to London. I mean, it's just fantastic. I think Andrew Williamson at the recent Investor Day that they had from Cambridge Innovation Capital said that from where we sat in Cambridge, 80% of life science and deep tech investment was, within an hour of where we were in Cambridge. Because it's because of the London link. So it will, investors will be able to travel up and back. So yeah, absolutely transformational. Any other questions for the panel? George, do you have a comment on the London link and what that might open up from an academic perspective?
Yeah, of course, it will enhance collaboration between the University of Cambridge, universities in London, and we're also looking forward to the Oxford link coming in. And down the road, we're looking through the Institute at re-establishing manufacturing for medtech. Certainly, better connections will help with that.
Okay, so I can see people are moving on, definitely maybe to the supercluster or whatever. So I'm going to make sure we finish with our big vision question to the panel. So the question is, if we're back here, we're sat here in 2035, and we've been successful way beyond our expectations. What would be true in 2035 that isn't true now? So Julia, can we start with you?
So with the caveat that, we need to pay pensions, and pension schemes need to be able to pay pensions as well. And we see, great opportunities, to make, good returns, the returns that we need in order to pay pensions. I would like to see more UK capital in UK companies, and more UK companies truly scaling and becoming, £1 billion, £10 billion plus companies in the UK.
Roland.
So 3 things for me. By 2035, I'd like there to be 5 new training and development buildings, centres across the county and the region, training our workforce for the future. Number 1. Number 2, I'd like to see Cambridge West with a major industry anchor tenant and an innovation hub to partner the innovation hub in the centre of Cambridge, based around 2 new industries of the future, one around aerospace, one around quantum, to be the spine for those industries and startups and scale-ups to come forward. Thirdly, I'd like to see transport infrastructure that will enable the housing to grow and people to live and commute in a way that's livable and exciting for them.
Thanks, Roland. Kathryn.
Thanks, Kathryn. By 2035, I would be thrilled if the tour that Roland's just been on in terms of looking at global exemplars around the world for how you can really maximise the innovation impact of real estate. I would love it if Cambridge West is top of people's list of where to visit. And I think within that, if we can demonstrate that we have genuinely created a pathway where organisations have started renting 1 desk from us and they're on a journey to taking 50, 100,000 square feet, I think we will have done a good job. And the second point is, because one of my colleagues is here in the room, is that by 2035, we will have delivered out the remaining phases of Eddington and we're able to house thousands more families and people working in close proximity to our major employment zone.
What a vision. And George?
Yeah. Have prevented spin-outs from leaving the UK and going overseas.
Fantastic. It's been a brilliant panel. I'd like to thank everyone for taking the time to come up to Leeds to talk about the amazing ecosystem we have in Cambridge. I think, what we've seen from this panel is the opportunity here is not just to grow Cambridge, but it is to demonstrate how innovation-led growth can strengthen the economy, create opportunity across the region, and also improve quality of life, particularly those medical interventions that George talked about at the beginning at scale. So it's a phenomenal opportunity. Really glad that everyone's in the room to go along the journey with us. Please take the time now. We do have 5 or 10 minutes to talk to people one-to-one, and please join me in thanking the panel.